Have you attended any inpatient coding interview recently? If yes, please mention in the comment section, mentioning it as yes. If not, please mention in the comment section as no. Why means basically this video is very useful for the people who wants to enter into medical coding, especially into inpatient coding. And we have collected all these Q&A from various company interviews where our students have been placed. These companies spread over India, USA and UAE. So today our topic is 100 plus latest inpatient coding common Q&A. If you are planning to go for inpatient coding interview and surely you want job, please watch this video until the end. In this video, we will learn 100 plus Q&A related to exclusively for inpatient coding. So first one is cerebral edema indicators. So what are the indicators for cerebral edema? Like traumatic head injury, seizures, memory loss, stroke, ICS, intracerebral hemorrhage, SDH, subdural hemorrhage edema. So basically these are the indicators for cerebral edema. If the patient is having memory loss or stroke or seizures, you can think patient might be have cerebral edema. Next question, where do you found or where do you find out cerebral edema in document? Most of the time you will find cerebral edema in CT of the head, MRI of the brain and carotid ultrasound. Most of the time you will find cerebral edema in radiology reports. Next, we need to understand what are the appropriate treatment for cerebral edema. Most of the time, the treatment for cerebral edema is hyperbaric oxygen therapy, osmotherapy, hyperventilation, and ventriculostomy. Those are basically surgical treatment. So these all four are surgical treatment. For example, if the patient wants to treat cerebral edema using the medications, so these are the medical treatment. Like patient needs to provide dexamethasone, corticosteroids, osmotic agents like mannitol and hypertonic saline and diuretics. And surgical treatment for cerebral edema, so decompressive craniectomy or hemicraniectomy. So basically here, in order to relieve the edema, physician needs to excise the cranium. So here in interview they will ask you one more question related to AKI and dehydration. So a patient with nausea, vomiting and lightheadedness for 1 week was admitted due to severe dehydration. So patient already having nausea, vomiting and lightheadedness. He was noted to have acute kidney injury secondary to dehydration and was treated with intravenous fluid. Which is the principal diagnosis in this situation, like dehydration or acute kidney injury? Whenever you want to decide principal diagnosis, you need to check reason for the encounter or reason for the admission here. Here, you need to query the physician regarding the principal reason that the patient was admitted. If the reason for the admission is not clearly documented, so there is no rule that acute kidney injury should always sequence first. So basically, whenever you have confusion whether can I code acute kidney injury or dehydration, you need to query the physician. If you code for based on the workup, you can code it as dehydration as the PDX. Why means physician has provided intravenous fluid administration. Otherwise, you can query the physician. What is the reason for patient's admission? Next question. For example, if the patient is having traumatic rib fracture and pneumothorax, which one you will select as PDX? Here, you need to code pneumothorax is PDX. So if you check in your tabular list, under rib fractures code, they have mentioned clearly you need to code underlying condition for pneumothorax. So here our underlying condition is traumatic rib fracture. So we need to code pneumothorax as PDX. Next question. Can we code hemiplegia from past medical history? Answer, no. That time we check for physical examination in the extremities. If extremities are mobile or not. The extremities are still not mobile, we can code hemiplegia. But if extremities are mobile, we don't code hemiplegia. So basically, In the documentation, if you find hemiplegia, you need to check physical exam. If patient is able to move extremities, you can't code hemiplegia. If the patient is unable to move the extremities, you can code hemiplegia from the past medical history or anywhere in the medical documentation. Next one, what is sepsis? So, SIDS due to any localized infection. Basically, sepsis is a blood infection or systemic condition. So, the treatment for sepsis is given is antibiotics. So, here they may ask, what is SIDS? What is SIDS? Systemic inflammatory response syndrome, which is the localized. Next one, what are the common localized infection sources for sepsis? So, the most of the time, sepsis will be due to localized infections like pneumonia, UTI, osteomyelitis, peritonitis, cellulitis, abscess, meningitis, inflammation, or influenza. So, if you observe this, so these all conditions are mostly inflammations. So, the underlying cause for sepsis is most of the time inflammation. So, next one, what is bacteremia? So, presence of bacteria in bloodstream is called as bacteremia. Simple. So, what is severe sepsis? So, sepsis with acute organ failure or acute organ dysfunction is called as severe sepsis. How many codes required to code severe sepsis? So, whenever you want to code severe sepsis, we need to have two codes. Okay. So, first code is for sepsis A41.9 and second code is for severe sepsis R65.20. Next one. If the documentation contains acute respiratory failure and if sepsis, here can you code severe sepsis? No, we can't consider severe sepsis. The causal relationship is mandatory for sepsis along with organ failure. So what is the key thing here you need to remember? Whenever you want to code any type of sepsis along with organ failure, the causal relationship is mandatory, which needs to be provided by the physician. If there is no provided documentation of combination or relation between sepsis and organ failure, we can't code. How do we code sepsis secondary to COVID? Here you need to code A41.89, other specified sepsis as PDX, and COVID U07 U07.1 as secondary code. Okay. Next one, encephalopathy secondary to sepsis. How do we code encephalopathy secondary to sepsis? So the type of sepsis considered as severe sepsis and the type of encephalopathy considered as metabolic encephalopathy. Okay, so here you need to code A41.9 first, R65.20, and you need to code metabolic encephalopathy code G93.41. Okay, what is septic shock? So severe sepsis associated with circulatory failure is called as septic shock. If you want to code for septic shock, you need to code two codes. First one is sepsis A41.9 and R65.21. Okay. What is the treatment for septic shock? The most common treatment for septic shock is vasopressors. Most of the time you will use these vasopressors for hypertension also. What are the drugs considered as vasopressors? So, vasopressin, phenylephrine, epinephrine, norepinephrine, dopamine, angiotensin, and telepressin. So, these all are the example medications for vasopressors. If the documentation contains septic shock and the documentation contains all these medications, you need to code septic shock. Okay. How do you code septic secondary to aspiration pneumonia? So here we need to code sepsis, aspiration pneumonia, unspecified pneumonia. Okay. Here we need to code A41.9, J69.0, and J18.9. Sepsis due to CAUTI. What is PDX in this case? So complication of urinary catheter infection as PDX, and A41.9 sepsis N39.0 UTI, and Y84.46 for external cause of injury. So basically what is CAUTI? Catheter associated urinary tract infection. Okay. So if the patient is having both sepsis as well as catheter associated urinary tract infection, you need to code T code. Most of the time we will use T codes for complications. We need to code T code as the PDX. So sepsis due to pneumonia and CAUTI. What is the PDX in this situation? So here we need to code sepsis as PDX and complication as secondary. So as per secondary sepsis guideline, sepsis due to any localized infection, sepsis as PDX, localized infection as secondary. Okay. So another guideline for sepsis, sepsis due to any post-operative complication, complication as PDX and sepsis as secondary. Given scenario, the source of sepsis is both post-operative complication and localized infection. So sepsis better DRG than complication. So we will give sepsis as PDX here or in this situation. So how do we code sepsis with aspiration pneumonia? Here we need to code sepsis first, then pneumonia and aspiration pneumonia. What is the sequence for coding of sepsis and COVID? So at present of admission sepsis and COVID, both conditions sepsis as PDX and COVID as secondary diagnosis. Okay. If the patient is admitted with COVID, the sepsis is developed during the hospital stay. The COVID will be the PDX and sepsis as a secondary with POA-N. Next one, what is chorioamnionitis? So basically this is like basically infection. So chorioamnionitis is a condition that affects pregnant women. In this condition, bacteria infects the chorion and amnion, the membrane that surrounds the fetus and the amniotic fluid. This can lead to infections in both the mother and fetus. So basically chorioamnionitis is the very complicated condition. So it may affect both mother as well as the fetus. Next one, hyponatremia and syndrome of inappropriate antidiuretic hormone. So how do we code this scenario if the patient documentation is having both conditions? Here you need to code only SIADH. Next one, acute respiratory failure and ARDS, acute respiratory distress syndrome. Both are documented in the documentation. How do we code? Here we need to code only ARDS. We will not code acute respiratory failure. Next one, cocaine induced chest pain. What is the PDX here? So here we need to code underlying cause as the PDX, which is cocaine poisoning and chest pain as secondary. And also, if anyone looking for medical coding jobs in UAE, USA and UAE and also in India, please join in our WhatsApp group. WhatsApp group link is in the description of this video. And also, if anyone looking for trainings related to same day surgery coding, IPDRG coding, SCC coding and CCS certification coding training, please contact 707-526-3939. And also, if you like this session, please click on like button and also encourage your friends to watch this video. Next one, which conditions considered non-physician documentation? So basically, what are the things you can take from non-physician documentation? So we can take BMI, we can take Glasgow Coma scale, and we can take stroke scale, we can take pressure ulcer stage and site and duration of loss of consciousness and laterality if physician did not mention in the documentation, but if non-physician documents in the documentation, we can code all these specificities. So tell me excision and resection root operations with few examples. Okay. So excision means remove a small portion of the body part. So like nephrectomy, biopsy. Okay. So excision of skin lesions, breast lumpectomy and liver biopsy. Okay. So these are here physician will remove part of the anatomical organ. Here physician will not remove complete organ. Okay. So resection means basically complete removal of the organ. Okay. For example, if the patient takes, so what do you call mastectomy? So mastectomy comes under resection. Why means during the mastectomy, patient will remove complete breast. Whereas in breast lumpectomy, patient will remove only part of the breast, which will comes under excision. Okay. So what are the examples for this resection? Talolobectomy, total lobectomy. Okay. So total mastectomy and total nephrectomy, cholecystectomy and appendectomy. So these are the examples for resection where patient will remove complete organ. So history of HTN and DMS are diabetes. How to code? History of hypertension and diabetes. So continuous medication is used. We can code current medication is not. Using these conditions result we can code as personal history. Okay. Whenever you want to code these conditions, you need to check the medications. If the patient is on current medications, you can code it as current code. If the patient is not having on any medication, you can code it as personal history. What is PTCA? Percutaneous transluminal coronary angioplasty. So most of the time PTCA is the surgical treatment for MI, which is myocardial infarction. For PTCA, you need to use the root operation dilation. And also during the PTCA, we need to check for the type of stent inserted, like drug-eluting, like Cypher stent, Endeavor, paclitaxel, sirolimus, nitinol, Promeus, Premier, and Toxal are non-drug-eluting stent, like bare metal, drug-coated, heparin-coated. And also you need to check number of stents inserted, and also you need to check number of coronary arteries involved. Okay. And also we need to check for bifurcation as well as atherectomy performed or not. So basically what is the difference between drug-eluting and non-drug-eluting stents? So it is simple. So drug-eluting stents will release the drug into the arteries, whereas non-drug-eluting stents will not deliver any type of medications into the stent. So what is the DRG value for PTCA with MI? So old DRG is 247. 1 to 3 drug-eluting stents. So new DRG is 322. For more drug-eluting stents, old DRG is 246, new one is DRG 321. So the old DRG is for non-drug-eluting stent is 249, whereas new DRG is 322. What is atherectomy? So basically ectomy means removal. So here atherectomy means a procedure to remove plaque from an artery. So most of the time you will see atherectomy in the arteries. What is the root operation for atherectomy? So the root operation for atherectomy is extirpation. What is IUPC? Intrauterine pressure catheter. So an intrauterine pressure catheter is a catheter used during management of labor to measure uterine contractions by taking into account intrauterine pressure. So basically during the labor management, patient will use this IUPC, intrauterine pressure catheter. The root operation for IUPC is insertion. What is IABP? So IABP means intra-aortic balloon pump, which is a type of therapeutic device. Okay, it helps your heart pump more blood. You may need it if your heart is unable to pump enough blood for your body. Most of the time, patient will insert this IABP pump after any type of cardiac surgeries, mostly like CABG or stent insertion in order to assist the repaired heart. The root operation for IABP is assistance. As this IABP will not take complete action of the heart, it will assist the heart during pumping of the blood. What is PICC line? So basically PICC line means peripherally inserted central venous catheter. So what is central line? So central line is also called as central venous catheter. Usually we will in the documentation we will see it as CVC. So CVC is a catheter placed into a larger vein in the neck or chest or groin. If it is in the neck area, internal jugular vein. If it is in the chest area, subclavian vein or axillary. Or if it is in the groin area, you can check femoral vein. What is the use of CBC? So CBC is used to administer medications or fluid or obtain blood test and measure central venous pressure. What is PICC line? So as usual, we have learned previously, PICC line means peripherally inserted central venous catheter. Here the location matters. In the peripheral inserted central venous catheter, physician will insert catheter in the cephalic vein, basilic vein or brachial vein, which are in the arm, and then advanced proximally toward the heart through increasingly larger veins. If the patient wants to use catheter for longer duration, he will use this PICC line. What is the use of PICC line? So PICC line is used for long-term chemotherapy or extended antibiotic therapy or total parenteral nutrition. So what is parenteral nutrition here? So parenteral nutrition means administration of medications through veins. What is enteral? What is the route operation for biopsy? So based on procedure, sometimes the biopsy route operation considered as drainage. Examples like FNA, biopsy of a liver, sometimes considered as excision like breast biopsy, skin biopsy, stomach and colon biopsy. Sometimes considered extraction like bone marrow and endometrial biopsy. So basically, whenever you want to code uh, route operation for biopsy, you need to check for whether physician is removing the fluid or tissue. If you want to code biopsy of fluids, you need to code it as drainage. If you want to code biopsy of tissues, you need to code it as excision. And if you want to code endometrial biopsies, you need to code it as extraction as the route operation for biopsy. What is the qualifier value for biopsy? So X is the qualifier value for biopsy. X indicates diagnostic. How many codes required for percutaneous needle biopsy of breast and open partial mastectomy? Here you need to use two codes. One code is for percutaneous approach for excision of breast for biopsy, and other one is for open excision of breast for open partial mastectomy. So what is the route operation for bone marrow aspiration biopsy and endometrial biopsy? So as we have discussed, the route operation for bone marrow aspiration biopsy and aspiration endometrial biopsy is extraction. Next, what is TIPS? TIPS means transjugular intrahepatic portosystemic shunt. So basically this procedure you will see in the liver. So TIPS is a procedure which involves inserting a stent to connect the portal veins to adjacent blood vessels that have lower pressures. So this relieves the pressure of blood flowing through the diseased liver and can help stop bleeding and fluid backup. So if you want to code TIPS, the route operation for TIPS is bypass. So what is the route operation for lymphadenectomy? Okay, so if the physician mentions I have removed only few lymph nodes, you need to code it as excision as the route operation. If the physician mentions I have removed complete chain of lymph nodes, you need to use resection as the route operation for lymphadenectomy. What is the route operation for cervical circlase? So here you need to use restriction. What is the route operation for nosebleed control? So distraction. So what is the difference between excisional and non-excisional debridement? So excisional debridement, the surgical removal of or cutting away the tissue necrosis are slow using any sharp objects like scalpel or blade. Okay. So what is non-excisional debridement? Here the physician will not use any type of scalpel or blade. He will use non-operative brushing, irrigating, scrubbing or washing of revitalized tissue, necrosis, slow or foreign material, Versajet, ultra-high pressure generator with a console and disposable attachments. So other examples for non-excisional debridement are ultrasound, wheel pour, mechanical scrubbing, wet to dry dressing, maggot therapy. So basically whenever you want to code this debridement, you need to check the technique, how physician is removing. If the physician uses scalpel or blade, we need to code it as excisional debridement. If the patient uses any type of Versajet or whirlpool or mechanical scrubbing, you need to code it as non-excisional debridement. Simple. Okay. Next, what is the root operation for excisional debridement? So, excision is the root operation. What is the root operation for non-excisional debridement? Extraction. So, how do you query for debridement? So, whenever you want to query for debridement, you need to check type of debridement, like whether it is excisional or non-excisional, and depth of the debridement, like skin level debridement, subcutaneous level debridement, muscle fascia, bone, tendon or ligament. What is CHF? So CHF is congestive heart failure, which will be caused by heart failing to pump enough blood around the body at the right pressure. It usually occurs because the heart muscle has become too weak or stiff to work properly. So basically CHF is related to heart muscles. If the heart muscles are weak, heart will be unable to pump enough blood. So we have two types of heart failures, systolic as well as diastolic. So systolic is the left ventricular loss. Okay, its inability to contract normally. The heart can't pump with enough force to push enough blood into circulation. So basically systolic heart failure you can see in the left ventricles, where left ventricle is unable to pump or contract normally. What is diastolic? Also called it as diastolic dysfunction. So the left ventricle lost its ability to relax normally. Okay. So systolic is contract normally. Diastolic is relax normally because the muscle has become stiff. So what is the treatment for CHF? So if the patient is having CHF, patient will prescribe IV Lasix, usually diuretics. What is cardiomyopathy? An acquired or hereditary disease of heart muscle. This condition makes it hard for the heart to deliver blood to the body and can lead to heart failure. So here basically pathy means disease, myo means muscle, cardio means heart. So cardiomyopathy is related to heart muscle. Because of this muscle condition, heart is unable to deliver blood to the body. Okay. So what is CAD? So coronary artery disease. So what is CAD? The buildup of fats, cholesterol and other substances in and on the arterial walls. So what is cardiac tamponade? It is compression of the heart caused by the accumulation of fluid inside the pericardium. What are the treatment for this cardiac tamponade? Pericardiocentesis, where you will use the root operations like drainage, body part, pericardial cavity. Or for creation of pericardial window, you will use the root operation drainage. Here body part you need to choose pericardium. What is encephalopathy? So here also pathy means disease, encephalo means brain. So disorder or disease related to brain or malfunction of the brain. What are the types of encephalopathy? So we have various types of encephalopathy like metabolic encephalopathy, toxic encephalopathy, hepatic encephalopathy, alcoholic encephalopathy, etc. So next, treatment of encephalopathy. So anti-seizure medications as well as antiviral medications and antibiotics. So what are the clinical indicators for encephalopathy? AMS means altered mental status, acquired loss of consciousness, seizures, elevated ammonia levels, and few more here. What is the difference between hypertensive urgency and emergency? Okay. A hypertensive urgency is a clinical situation in which blood pressure is very high with minimal or no symptoms and no signs or symptoms indicating acute organ damage. Okay. In contrast with hypertensive emergency where severe blood pressure is accompanied by evidence of progressive organ or systemic damage. In hypertensive urgency, you can't see any type of organ damage, whereas in hypertensive emergency, you can see the organ damage. Okay. What is the root operation for crushing of stones? Fragmentation. So how do we code type 2 MI secondary to demand ischemia? Here you need to code only type 2 MI. So what is the difference between initial and subsequent MI? So the patient admitted for first time, we will consider it as initial MI. Again, the same patient readmitted within 4 weeks of the initial MI. We will consider it as subsequent MI. So these are the types of MI. Type 1, type 2, type 3, type 4, type B, type C based on the myocardial infarction related to PCI. Okay. So type 2 MI secondary to any condition except demand ischemia, underlying condition as PDX, and type 2 as the secondary. Okay. When we call lysis of adhesions. Okay. So in order to call lysis of adhesions, we need to check the keywords in the documentation. Like extensive lysis of adhesions, or the patient spent greater than 30 minutes for lysis of adhesions, or if the documentation contain dense adhesiolysis, we can code. What is the root operation for lysis of adhesions? So release is the root operation for lysis of adhesions. What is embolization and root operation for embolization? So what is embolization? Embolization refers to passing and lodging of an embolus within the bloodstream. Okay. So it may be of natural origin, in which sense it is also called embolism. For example, pulmonary embolism. The root operation for embolization is occlusion. Okay. So what is the difference between AKI and ATN? So acute tubular nephrosis is the most common cause of acute kidney injury. Okay. So here ATN is the underlying cause in the renal category. So the term ATN is actually misnomer, as there is minimal cell necrosis and the damage is not limited to tubules. Okay. So what is the meaning of PROM? So premature rupture of membranes. Okay. What is abortion? Termination of pregnancy before 20 weeks is called as abortion. Okay. So what are the discharge dispositions affects DRG assignment? Okay. So AMA, expired, baby transferred to another facility in newborn case. So these are the dispositions which will affect DRG assignment. So what is AMA here? AMA disposition. Okay. AMA means basically against medical advice. Okay. So give me one example for AMA disposition change scenario. Alcohol abuse and drug abuse. Give me one example for expired disposition change scenario. MI or cardiac arrest. Tell me about the induction methods. So what are the induction methods? You can see in the documentation mostly pitocin injection, Cervidil, Cytotec or oxytocin. Basically these are all the medications. Most of the time in the documentation you will see for induction. What is the difference between induction versus augmentation? Okay. So there is a difference between labor augmentation and labor induction. Labor induction is the process of starting labor before it begins on its own. Whereas augmentation of labor is when labor is already in progress but needs little help to move along. Okay. So that is the difference between induction and augmentation. Next, what is the difference between tunneled and non-tunneled catheters? Okay. So tunnel catheter are placed under the skin and made to be used for longer duration of time. Non-tunnel catheter designed to be temporary and may put in the vein near neck, chest or groin. So in the documentation, if you see incision and placement of the catheter, you need to code it as tunnel. If there is no incision in order to keep this catheter, you will code it as non-tunnel. What is the difference between PIC and CVC? So as we have discussed previously, PIC is peripherally inserted central venous catheter, CVC central venous catheter. Most of the time physician will use these two types of catheters for medication delivery as well as blood products delivery as well as nutrients delivery. So what is the difference between transfer and replacement? Okay, so transfer means moving without taking all or portion of body part to another location over the function of all or body part, like tendon transfer or skin pedicle flap transfer. What is replacement? Putting in or on a biological or synthetic material that physically takes the place of function of all or portion of a body part, like heart valve replacement, total hip replacement, replacement of cornea. Transfer is just moving from one location to another location. Replacement is Here there is no transfer. Basically, fission will replace the wall or hip. What is the difference between kyphoplasty and vertebroplasty? So in vertebroplasty, patients use imaging guidance, typically most of the time fluoroscopy, to inject cement mixture into fractured bone through hollow needle. Here you need to use the root operation supplement. Whereas in kyphoplasty, patient will insert the balloon through the fractured bone, and using the hollow needle, patient will create the space first, then he will inject the cement. For root operation for kyphoplasty, supplement. Approach percutaneous. What is the difference between occlusion and restriction? So occlusion is completely closing an orifice or lumen. Okay. So examples for occlusion are ligation of esophageal vein, sterilization, embolization of internal carotid cavernous fistula. What is restriction? So restriction means partially closing or narrowing. What is the root operation for PTCA? Okay, so the root operation for PTCA is dilation. Okay, so what is CABG? CABG means coronary artery bypass graft. And also, if you like this session, please click on like button so that I can create more videos related to inpatient medical coding interview common Q&A. What is half pump CABG? So half pump is basically here patient will not use any type of cardiopulmonary bypass. Okay, or here patient will not use pump. What is biventricular ICD? So a biventricular ICD and pacemaker is a small lightweight device powered by batteries. This device helps keep your heart pumping normally. What is AICD? Automatic implantable cardiac defibrillator. What is the root operation for VP, ventricular peritoneal shunt placement bypass? Okay. Explain about PCS code structures. So each and every PCS code is having 7 digits. First one is for character, second is for body system, third is for root operation, fourth is for body part, fifth is for approach, sixth is for device, seventh is for qualifier. So how many root operations in PCS? In PCS we have total 31 root operations. So 89th question, how many approaches in PCS coding? What are the approaches? In PCS we have total 7 approaches. Open, percutaneous endoscoping, via natural or artificial opening, via natural or artificial opening endoscopic. Okay, so via natural or artificial opening percutaneous endoscopic, and external. 90th, how many sections in PCS coding? In PCS we have total 17 sections. How will you consider mechanical ventilator start and stop time? Okay, so the time of intubation will be considered as start time. The time of extubation is considered as stop time. The course will depend on duration of ventilation, such as less than 24 hours, 24 to 96 hours, greater than 96 hours. So 92, CPAP BiPAP. What is CPAP and BiPAP? Okay, CPAP means continuous positive airway pressure, where tracheostomy will be coded as mechanical ventilation. What is the root operation for mechanical ventilation or ventilator? So the root operation for mechanical ventilator is performance. What is the root operation for CPAP? So root operation for CPAP is assistance, which means taking over a portion of a physiological function by extracorporeal means. So here extracorporeal means outside the skin. So what is the difference between mechanical ventilator versus CPAP? So a ventilator, technically a mechanical ventilator is a machine that moves air in and out of the lungs and does the work of breathing that the diaphragm and other muscles normally perform. A standard CPAP machine provides one constant pressure and cannot move air and in and out. What is the root operation for tracheostomy? So the root operation for tracheostomy is bypass. So tell me about few newborn conditions. So jaundice, most commonly you will see jaundice, sleep apnea, CAPAT, Mongolian spot, like all these things. What is inpatient coding? In inpatient coding, if you want to consider it as the patient to stay more than 24 hours. Okay. What is payment system of IPPS, Inpatient Prospective Payment System? What are the type of document which we have to be handle in IPDRG accounts? Okay. So basically, what are the documents you need to code? IPDRG or inpatient coding. So these are the documents which are summary, progress note, consultant, pathology, OP notes, history, physical, EED, case management, radiology, physician order, sometimes nurse notes for BMI, stroke scale, as Glasgow gamma scale, as well as pressure ulcer stage and site. So what are the elements in IPDRG coding? Admitting diagnosis, principal diagnosis, secondary or additional diagnosis, principal procedure, as well as secondary or additional procedures. So what are the elements require assigning secondary codes? So if you want to consider secondary diagnosis in the operative report or in the documentation, patient needs to do any type of diagnostic workup, therapeutic treatment, increasing care, clinical evaluation, or extended length of stay. DRG. What is DRG? Diagnosis related grouping system. So these are the types of DRG: MSDRG, APRDRG, SDRG. Okay, and one DRG value classified into three types: with MCC, with CC, without CC, or MCC. Okay, guys, we will stop here. So if you like this session, please mention in the comment section. And if you have any doubts, please mention in the comment section. If you like this session, please click on like few more scenarios here. So nearly we have all these questions. If you like this session, please click on like button so that I can create one more video related to remaining Q&A. And also, if anyone looking for jobs in UAE, USA and India, please join in a WhatsApp group. Group link is in the description of this video. And our trainings will be same day surgery coding training, IPDRG training, SCC training, CCS certification training. And if you are looking for all this training, please send WhatsApp message to 707 526 3939.